No.
I'm reading your comment, AJ Floors. Yeah, I have dealt with cherry eye before, so let's talk about cherry eye today. First of all, sorry to hear your dog have cherry eye on both eyes. It's a real pain in the neck. Most people have heard of cherry eye if you own a cane corso or you're about to own one. If you're about to buy a dog, please check up its common health issues because it's so important. Unfortunately, cane corso isn't one of those breeds that is free of some common health traits. You have got elbow, hip problems. If your dog cannot walk, having hip dysplasia, that's a big problem. Maybe a bit of heart, and cherry eye is very common. One common misconception is cherry eye is okay, let's talk about what cherry eye is first. Cherry eye is a tear gland that pops out. I'll show you some picture of it. And why is it such a pain in the ass? Because there is no straightforward way of fixing it. Some people will just cut it off. And nowadays, a lot of veterinarians will not do that because cherry eye is basically a gland, a functional gland that is supposed to produce tears in your dog's eye. So if you cut it off, it is going to lose that organ and you might end up with dry eye. But one thing most people don't know is there are two glands, one on top, one on the bottom. And the top one is producing most of the tears. So if you cut off one of them, it's not going to go 100% dry. That's why we don't know if it's 50-50 or 30-70. Actually, the one at the bottom is producing less than the top. However, that's not saying if you cut it off, that top one is going to produce enough tear for the eye. And if you go and ask your vet, you'll realize how expensive it is to buy those tears. And it's everyday constant work to make sure its eye is properly lubricated. So cutting it off is the last thing people would do. And like you said, your vet would not do it. Well, the vet in your area would not do it. There's a good reason for it because it's very risky. Most people would not want to cut off the tear gland because you could end up having bigger issues. Your dog could lose an eye. However, if you leave it out here, you have that gland hanging out, there is a chance it might still have dry eye. I think it's a lot safer if your dog's like mine. My dog's an inside dog and they are kept clean all the time. But if your dog is outside, having dirt into his eye and having the cherry eye gland popping out like that there's more chance of infection and there's bigger problems. So should you have a cherry eye there and not touch it? No surgery at all. Again, it depends on the dog. If your dog is having cherry eye and it's all swollen, it's really bad, yes, you have to have it done. And if your dog is having a cherry eye popping out there and it's been months and months and your dog seems to be okay with it, you may not have to do anything about it except it looks pretty darn ugly. And when you walk your beautiful cane corso outside, everybody goes, "What a beautiful dog!" And ooh, what is that? That's cherry eye. What's cherry eye? That's something you have to live with. So I'm just reading through your comment here, your question here. Mine has a cherry eye on both now, and the cost of putting them back like a pocket is way too high. Yes. Let's talk about some of the methods, some of the ways a veterinarian could use to treat your dog's cherry eye. You will see some treatment online telling you how they can fix cherry eye by pushing the gland back. That's not fixing the problem. That's pretty much put it back for a few seconds, a few minutes, a few hours, and you pop back out again. That's not fixing it. A lot of people think cherry eye is because of the loose skin, because, Neapolitan Mastiff, a lot of Mastiff dogs, a lot of bull breeds, bulldogs, have loose skins and you got cherry eye popping up. People think, oh, that's because of their loose skin. False. Cherry eye, every dog have their gland. How come this bull breed, King Charles Spaniel, the small dogs, have cherry eye? It's actually their bone structure. So how do you avoid cherry eye? I think the closest bet you can get is buy from a reputable breeder who have bred many dogs over many years. They have both sire and den health checked. This is probably the best bet. I mean, you could still buy a dog came from a really good bloodline. Parents, grandparents, great-grandparents all have their health check, and they still end up with health problems. Yes, that's possible, but that chance is greatly reduced. And if I was you, I've done all that, and the dog still have cherry eye or other health problems. It's super bad luck, but at least you can say, I have done all I could. I've seen some dogs for sale in America, some kind of course, so they're as low as like $300 to $600. Super cheap, dirt cheap. I mean, a Cane Corso can eat that much food in just a few months. $600. I mean, I told you it's $15 a day. So if I was feeding my dogs $15 a day, 1 year will cost me $4,000 just for food. Okay, so you know, a standard Cane Corso in your area, my viewers are usually in USA, it will cost you about $2,000 up. And some breeders don't do any health check at all. They'll still charge you that much because their dog come with papers. And the people who do health check, they also charge you that much. Now, one makes more profit than the other because they don't health check your dog. Who would you buy from? The one who health check their dog, have their eye checked, health, hip score, and all that done to prove to you that they have done the same for their parents, great-parents, great-great-parents. That if you haven't got a dog yet, that's probably the best thing you can do. Forget about anything, number one, because once your dog gets sick, it's not fun at all. So let's pretend that's your dog's eye. That looks like an eye, right? And usually the gland is about this big, roughly, proportion-wise. It sits inside here and produce tears. But what happens with cherry eye is that the bone isn't going to hold it. Just the facial structure allow this organ to kind of pop out here. Instead, just sticks out. That's what cherry eye is. And the ways to fix it is, like you mentioned, there's the pocket method. There is actually membrane in this area. They just cut the membrane open and put this thing, the gland, into the membrane, and because the membrane is down here, so you kind of just try to hold it back in here. That's what you call the envelope. That's the method you were talking about. There is also a suture method, which they kind of use two sutures to hold it and try to pull it back down. And they can do both. So it will be more expensive. They can use the pocket and suture method to do both. Sounds great, right? But in my experience, that can also fail. If your dog is a smaller breed, that cherry eye is a lot easier to fix. Unfortunately, if you own a Mastiff, a Cane Corso, there is no guarantee. So, you mentioned about it's really expensive to do the pocket method. It could still fail. And whether your vet will charge you the same price for every surgery, I'm not sure. So like I said, I know you are asking for my experience, and that's my experience. If you're unlucky, there's another way, which means they cut the tear gland half. They actually chop it to make it smaller. Then they can use the envelope or the suture to push it back. Then the suture is actually attached to the bone to pull it down and see if it can work. And finally, if it doesn't work, some might cut it off. But like I said, usually for most of it, that will be the last resort because they lose their functional organ. So what's the right approach? If money is not an issue, try and fix it first. But money is always an issue for most people. And I don't know, in my city, a cherry eye surgery could range from $600 to $1,500 per surgery. But some other veterinarian, I have met some vet, they will take responsibility. It's not something anyone can guarantee. I can tell you that. They can't guarantee they can fix it, but they would do more for you if they can't fix it. And some of the vets I know are very, very good. So, like I said, it is a big problem. The only way in the future for the sake of the breed is having all the breeders to do their health check to breed this problem out of the breed. I guess that's the only way. But is it possible? I'm not sure, because a lot of other breeds have the same problem, not just Cane Corso. So unfortunately, I don't have the right answer for you. It's one of those health problems that they don't have a straight answer. So I wish you the best, and hopefully it works out for you. Thank you. All right, this is my Corso. That's not cherry eye, by the way. That's his third eyelid. It's not that gland that popped out. He's so chilled, he doesn't really care. If he's got cherry eye, you can just push it back in. I mean, it looks nasty, but if your hands are clean, you can actually do that and continue to massage this area here, because the muscle tissue is too weak to hold it, plus the bone structure here, it doesn't hold it. That's one way to see if you can sort of help it if it's not too bad. It depends on the size of the gland. If the gland is so big, after surgery it still pop back out, and that's the sucky part. I would talk to your vet and talk to different vet. I mean, cutting it off I think will be the very last resource. Like I said, there's a very good reason why the veterinarian are refusing to do this. If they can do it, the reason they don't want to do it is because of the risk involved. You could cut off that gland and end up with a dry eye, and you might want to do some research about what dry eye does to a dog and how it affects your life, because that's something that you have to care for 24/7. It's your decision, but it's not an easy one. Finally, the biggest problem with cherry eye, I think for humans, it just looks but ugly. But for the dogs, it doesn't bother some dogs. If it's getting infected all the time, you have to deal with infection all the time. It's getting a vicious cycle of infection. Yes, you have to do something about it. But if it doesn't bother the dog and it never has any infection, it's not red, it's just popping out there all the time, you are able to keep it clean. There's never any problems, and you can live with the looks. It's not eyesore to you. That is more about us than the dog. You can leave it, and like you say, if your option is to cut it off, I will leave it for as long as possible. Why do I say that? If you cut it off and finally you start to get dry eye and you have to spend a lot of money taking care of the eye, wouldn't you want to leave it till later? Let's say if you can live until he's 8 or 9, average Cane Corso age is 10. If they live till that long, that you only have maybe a couple of years to take care of. If you cut his gland off when he's 5 months old, 6 months old, you got a long way to go, mate. So if I was you, that's one thing I would consider. Can I leave it till later, or do I must do something about it now? Yeah, it's a tough call, man. It's a tough call. Like I said, I wish you all the best. It's not one of those things that people go, yep, here's the solution for you. If you look at our dog, they're happy, then we should be happy for them. If it's a really problem, then talk to the vet and see what options are out there. Thank you. See you next time.